My name is Dr. Adam Farber, and I would like to present to you a video of an arthroscopic medial meniscal repair surgery. The procedure begins with the arthroscope in the medial compartment of the knee. For orientation purposes, the femoral condyle is on the top portion of the image, the tibial plateau is on the bottom, and the medial meniscus sits between the two structures. Initial evaluation of the medial compartment reveals no significant cartilage damage on either the femoral condyle or tibial plateau. Also, the medial meniscus appears to be unremarkable initially, but the MRI revealed a tear in the back portion of the meniscus. Next, a needle is inserted through the skin to localize the appropriate position and optimal trajectory for an incision to ensure access to the site of the meniscal tear. A scalpel is then used to make a small incision, which is used to insert instruments to perform the meniscal repair. A probe device is used to evaluate the meniscus until the tear site is identified. This is a peripheral vertical tear involving the medial meniscus. There is slight instability across the tear site, as seen here. After the tear site is identified, the meniscus is repaired to optimize blood supply prior to completing the repair. Meniscal tissue has a very poor blood supply and limited healing potential. First, a ball rise device, as shown here, is used to abrade the tissues at the tear site to stimulate bleeding. Next, a shaver is inserted to remove soft tissue debris from the tear site and create additional bleeding. Finally, a needle is used to create small holes across the tear site which allow for additional bleeding and the ingrowth of blood vessels called vascular access channels. After the meniscus tear site has been prepared, the meniscal repair devices are inserted beginning in the back portion of the meniscus. After the first implant is inserted, the second implant is inserted 5 millimeters in front of the first. The insertion device is then removed. Next, a suture pushing and cutting device is used to cinch down the sutures and secure tension across the repair. Tensioning of the repair is shown here. Then the excess suture strand is cut. Next, the second repair device is inserted in front of the previous sutures to repair the front portion of the tear. After the first implant is inserted, the second implant is placed approximately 5 millimeters in front of this across the side of the tear. The inserter device is removed. The knot pusher and cutter device is then used to cinch down the sutures and tension the repair. Finally, the excess suture material is cut. After the repair is complete, there is noted to be excellent stability of the repaired meniscal tissue with no evidence of displaceability, as is shown with the arthroscopic probe here. This image shows the initial meniscus tear on the left and the same area after the meniscal repair has been performed with 2 suture devices. Finally, in an effort to create additional bleeding and bring in healing elements in the bone marrow to augment the biologic healing potential of the meniscal repair, several small holes are made into the bone in an area devoid of cartilage using a pick-type device. This is known as a microfracture. This completes our meniscal repair. Thank you.